Okay, so I'm going to start by performing proper hand hygiene before I do anything else. I'm going to wash my hands, and then I'm going to introduce myself to the patient. So, hi, my name is Amanda. I'll be your nurse today. Can you please verify your name and your date of birth?
My initials are MS, and date of birth is 082696.
Okay, alright, and do you have any allergies?
Amoxicillin.
Alright, and what happens, what kind of reactions do you have when you take
Hives.
Hives? Okay, alright. So, I'm going to start by assessing his heart rate and respiration rate. So, I'm going to locate the radial artery. Alright, and so to get his heart rate, I will first find out if his pulse is, or heart rate is regular or irregular, and since it is regular, I am going to count to 30 and then multiply it by 2. So that is how I find his heart rate, and then to find his respiration rate, I would count how many breaths he has in 1 minute. So I would watch the rise and fall of his chest with an inhale and an exhale being 1 breath. And so I would count that for 30 seconds and then multiply it by 2 again to get my respiration rate. Okay, so next I will go ahead and inspect the status of the patient. So I see that he is sitting up straight. He appears to be in no acute distress. He is making good eye contact. He's speaking clearly. And so then I will go ahead and I will inspect for jugular venous distension. So then to do that, I will rotate his neck at a 45-degree angle on the left side, and I will look between the sternocleidomastoid muscle and the external jugular vein, and it appears to be normal. And then I will, since I inspected the neck, then I will go ahead and palpate the carotid artery for carotid pulse. So use 2 fingers. Okay, and then I will do this one side at a time. So I'll switch sides. Okay, all right, and then those both were 2+. Okay, and then I will auscultate his carotid arteries. Again, separately on both sides. So breathe in, exhale, breathe in, exhale, and again. Okay, and I'll go to the other side. All right, breathe in, exhale, breathe in, exhale, and again. Okay, all right. So then, next I will go ahead and inspect the pericardium. So to do this, I will locate his apical impulse, and so that would be the 5th intercostal space on the left side near the midclavicular line. So 1, 2, 4, 5, midclavicular line. Okay, so then I would look at the symmetry, and they appear to be symmetrical. So then I would go ahead and palpate the apical impulse. So again, 5th intercostal space. So 1, 2, 3, 4, 5, midclavicular line. Okay, and then that was about 2+. Okay, so then I will go ahead and auscultate heart sounds. So I'll put my stethoscope on. Alright, and I'm going to start at the aortic area, and that is found at the 2nd intercostal space on the right sternal border. So 1, 2. Okay, and then I'm going to move on to the pulmonic area, which is 2nd intercostal space on the left sternal border. Okay, and then I'm going to move to Erb's point, which is the 3rd intercostal space. 1, 2, 3. And then I will move to the tricuspid area, which is the 4th intercostal space, left sternal border. And then I we'll auscultate the mitral area, which is the 5th intercostal space near the midclavicular line. Okay. And then I will do the same thing, this time using the bell of my stethoscope. So, again, aortic area. Okay. Pulmonic area. Okay, Erb's area, Erb's point. Tricuspid area. And the mitral valve. Okay. Okay, and next I will inspect both of his hands and his nails and arms. So, inspecting his hands, they are normal color, normal temperature, and his nails, normal. Okay, and then I will assess his capillary refill. So I will press on his nail bed and see how fast. Okay, so it refilled within 2 seconds, so it is normal. And then I will go ahead and palpate his radial, ulnar, and brachial arteries. So I will do the radial arteries at the same time. Okay, and those are 2+. Then I will do the ulnar arteries. Again, 2+. Then I will move to his brachial arteries. Okay. All right, again, 2+. And then I will go ahead and have you open your legs up here. Okay, inspect your legs and your feet. Okay, so first I will inspect his legs and his feet. There's no discoloration, normal color, and there is no abnormal hair distribution on his legs. So then I will go ahead and palpate for pretibial edema, so both sides. Okay, both sides have a grade of 0. I'll palpate for pedal edema, both sides. Again, grade is 0. And then I will go ahead and palpate for his popliteal pulse bilaterally. So, okay, those are 2+. And then I will go ahead and palpate his posterior tibial pulse. Again, 2+. And then his dorsal pedis pulse. Again, these are 2+. Okay. All right, so then I will go ahead and to end the assessment, I will ask if you have any questions or concerns.
No.
No? Okay.